Now, let's look at this scenario. Your post-op patient looks okay. Vitals are normal. Dressing is dry and intact. But something is off. Here is the truth. By the time BP alarm goes off, your patient has already lost over 1.5 liters of blood. Internal hemorrhage heights. Your job is to find it first. Now, I'm giving you the acronym PALE, PALE. 4 things that show up before the crash. Let's go. P, pressure trends down. Now, don't just read the number, read the trend. Heart rate creeping up from 78, 88, 96, then to tachy, 104 over 2 hours. That is compensation going on. That is your patient's body fighting to stay alive. BP holding at 110, but their baseline is 145. That is relatively hypotensive for those patients or for that patient. Know your patient's baseline, which is very important. And watch the pulse pressure. That is your systolic minus your diastolic. The normal pulse pressure is 40 plus. Anything under 30, that is hemorrhagic shock flag. The vessels are clamping down, trying to hold pressure while volume disappears. The monitor catches the end, unfortunately. Vital signs trends catch the beginning. A, agitation and anxiety. When the brain stops getting enough blood, it gets scared. Restlessness that feels different. Not I need to reposition type. This is a deeper one. I can't feel comfortable, and that's what they will tell you. They are trying every ways and means to feel comfortable, to reposition it, but still it's not helping. Picking up blankets. Anxiety with no clear cause. Some patients will tell you they feel something is wrong. Believe them. New confusion in a previously alert post-op patient is a red flag. The brain is the first to show when perfusion is dropping. Now L, low urine output. Remember, the kidneys are the canary in the coal mine. Normal urine output is anything, it should be 30 mils an hour. Okay? Any drop below than that, your kidneys are telling you they are not getting enough blood flow. This is one of the earliest, most objective signs of hemorrhagic shock. And it shows up before BP crashes. Are you measuring hourly? Are you documenting it? This is exactly why it is very important to do strict in and out post-op. Now E, everything. This is your full body read. Skin is pale, cool, clammy, diaphoretic. The body is shutting blood away from the peripheries to protect the core. Check the lips, nail beds, conjunctiva. Respiratory rate, it's climbing. The body compensates for acidosis buildup from poor perfusion. Abdomen. For your abdominal post-op patients, there's increased firmness. There's this tension. That is blood filling a cavity you can't see. Orthopedic patients, look at the thigh, look at the hip, the femur, and see if there's any bleeding, okay, into the surrounding tissues. Put it together. One sign maybe it's time for you to call. You see the picture? Here is your move. Stay with the patient. Don't leave. Call the provider or get a nurse to stay with the patient. Use your S-bar and be direct. Heart rate is trending up, relatively hypotensive compared to baseline, diaphoretic, restlessness, urine output is dropping. I'm concerned of hemorrhagic and need you to do something about it. Give numbers, give trends, state the words. Make sure there's large IV access, put them on oxygen, lay them flat and position their legs up. Activate your rapid response if you have any. Don't wait for a crash. Okay, in summary, PALE, P-A-L-E, pressure trends, agitation, low urine output, everything else. The most sophisticated monitor in that room is you. Trust the picture. Call it early. Okay? Like, subscribe, and drop a comment. What is your most subtle hemorrhagic sign you've caught on the floor? See you next time. Bye.